Is your skin trying to tell you that you have diabetes or problems with your blood sugar? So I'm Tiffany, I'm a physician assistant, but I'm also a GLP-1 advocate. So I spend a lot of time helping people get access to GLP-1s that can't get them through traditional insurance. So if that's something that you struggle with, there are some links over here in my bio that hopefully can help you out with that. So your skin can actually be one of the first signs that we see diabetes or prediabetes, but most people have no idea what to look for. So as a healthcare provider, let me just tell you some of the really common things that I always watch for. So the first one is actually dark, velvety patches, and we usually see them on your neck, your underarms, and in your groin. Now we have a big fancy word for this, and it's called 𝐼chn's nigricans. Now, we almost always associate this with diabetes or prediabetes. This is actually seen in up to 74% of people with that diagnosis. So if you've noticed darkening skin in those areas, and I'm gonna put a picture right down here, then you need to get checked out. Make sure you get some blood work. Number two might surprise you. So skin tags. Now, although they're common, when they start showing up in large clusters, especially if they're showing up around your neck or around your underarms, that actually points to elevated levels of insulin and insulin resistance in your blood. Number three, frequent itching or extremely dry skin. Now this one's really hard to know because there's lots of conditions that can cause dry skin, but elevated sugar can actually pull moisture from your skin and really cause a dry skin situation, which is really hard to rectify with any sort of like lotions or anything. Because diabetes affects circulation, you may notice this more on your legs, arms, and your feet. So if you notice that your skin is extremely dry for no good reason, it may be a reason to go ahead and get your blood work checked if you haven't had it done in a while. Number four, very slow healing cuts or frequent skin infections. So I see this one quite a bit. So if every little cut that you get does not seem like it wants to heal, or if you keep getting skin infections, especially in those places that tend to stay moist, like your groin or your underarms, and you're getting like a yeast infection situation there where you're getting like a red, irritated rash and it won't go away, that's a pretty good sign that you've got elevated levels of sugar going on in your system. So yeast actually thrives on a high sugar environment, even on your skin. So we tend to see these happen in people with diabetes or prediabetes. And the last one is red or brown patches that show up on the shins. So these are often mistaken for bruises, but we see this in 50% of people who have long-term diabetes. So this is a condition we know as diabetic dermopathy, but this condition is often misdiagnosed and people just think that their shins are bruised up. Now this is actually caused by poor circulation and nerve damage to the areas that are in your extremities, so your arms and your legs. So let me post a picture so you can see what I'm talking about here, but this is definitely something if you're noticing you need to get checked out. So if you're noticing any of these skin changes, you definitely need to get it checked out, especially if you have a family history of diabetes or prediabetes. Prediabetes is totally reversible, but you have to get it checked, and we definitely have to start introducing some changes in your diet and your lifestyle right away. So let me know if you found this video interesting, and definitely reshare so that other people can know this as well. All right, guys, y'all have a wonderful day.